Every 40 seconds. That's how often someone in the world suffers a stroke. And the crazy thing is, so many of them never see it coming. They're just completely blindsided by a devastating medical emergency. But what if I told you that your body actually sends out a silent alarm hours or even days before the main event? Before we begin, subscribe to @Dr. Health Explained for evidence-based health insights.
Okay, let's dive right into this. You see, strokes don't just happen out of nowhere overnight. That 40-second statistic we just talked about is a pretty chilling reminder of how frequently they strike. But the reality is that your body often sends these fleeting, temporary alarms hours or even days before a major stroke actually hits. The problem is, they are dangerously easy to brush off. We ignore them because they pass so quickly, right? But these are critical cries for help from your vascular system that we literally cannot afford to ignore.
So, here is our roadmap for this explainer. 1. The silent stroke warning. 2. Temporary vision loss. 3. Body numbness and balance. 4. Speech loss and headaches. 5. The hidden risk factors. And finally 6. Time equals brain. We're going to systematically decode these life-saving warning signs and the hidden risks behind them. All right, moving right into section 1, the silent stroke warning. Let's uncover the medical reality behind these temporary glitches in the body. We're talking about a TIA, or a transient ischemic attack. Basically, it's a temporary disruption of blood flow to your brain. Think of the carotid artery in your neck. You know, the main pipeline bringing fresh blood from your heart right up to your brain as a plumbing pipe. Imagine years of cholesterol and plaque building up in there, kind of like rust, slowly narrowing that pipe. Suddenly, a tiny piece breaks off, or the flow just stalls for a few seconds. A part of your brain goes completely dark. Then boom, the blockage clears, your symptoms vanish, and you think you're perfectly fine. But here is the terrifying truth. Experiencing a TIA leaves a critical 72-hour high-risk window for a massive, full-blown stroke. Now, during that 72-hour high-risk window, the body might trigger one of 5 crucial alarms. We're looking at vision loss, sudden numbness, loss of balance, speech disruption, or totally new headaches. It is so easy to just brush these off. People fatally dismiss them as just fatigue, stress, maybe a bad night's sleep, or sitting weird at their desk. But as you're going to see, these are absolutely not things you can just sleep off. Let's jump into section 2. Temporary vision loss, which signals a major disruption in the connection between your eye and your brain. Patients often describe this as a black curtain falling over one eye. Imagine you get up to walk to the kitchen, and suddenly the vision in just one eye goes completely dark, or a heavy gray spot covers your entire field of view. It might last just a minute or even a few seconds before going back to normal. People brush this off as a sudden drop in blood pressure or staring at their screens for way too long, but medically speaking, this is a massive red flag. The blood vessel feeding your eye branches right off that exact same main carotid artery feeding your brain. If a tiny clot temporarily shuts down your retina, that exact same clot, or the very next one, is heading straight for your brain. Let's move to section 3. Body numbness and balance, and see how this builds up with your body's physical alarms. Here is a fascinating yet completely terrifying detail: sudden tingling or numbness on exactly one side of the body. You might be sitting on the couch and suddenly half your face, one arm, or one leg feels incredibly heavy or like it's full of pins and needles. Now sure, we've all had an arm fall asleep because we slept on it wrong, but that's just a pinched nerve. You shift positions and it's fixed. This warning sign is a whole different ballgame, because each hemisphere of your brain controls the opposite side of your body. A clot temporarily starving one side of your brain is going to cause numbness strictly on one side of your body. There is another physical alarm, and it relates to the cerebellum. That's your brain's center for balance and coordination. Imagine walking on a completely flat, familiar surface, and suddenly you just start staggering. You literally can't put one foot in front of the other, and you have to grab a wall or a chair just to stay standing. People describe it as feeling suddenly wildly drunk without having had a single drop of alcohol. This happens when blood flow drops to the cerebellum. It's a sudden, terrifying loss of balance that you must never chalk up to just being tired or clumsy. Moving right along to section 4, speech loss and headaches. Let's talk about the brain's communication centers and how pain signals can be a desperate cry for help. And this brilliantly illustrates how complex our brains are, because there are actually 2 distinct types of temporary speech loss. If a clot hits what's called Broca's area, you know exactly what you want to say, but the words just won't come out. You might stutter, speak in broken words, or completely freeze up. On the flip side, if Wernicke's area is affected, you might speak totally fluently, but the sentences make absolutely zero sense. It's just a jumble of words. You might not even understand what other people are saying to you. If this happens suddenly, even if it completely resolves in a few minutes, your brain is loudly telling you that its blood flow was compromised. Then there is the pain signal, a severe headache that completely breaks all your normal patterns. Now, let's be clear, most headaches are totally harmless, but if you get an unprecedented, incredibly sharp headache that strikes out of absolutely nowhere, especially if it brings along vision changes, numbness, or those speech issues we just talked about, this is a glaring emergency. It can actually signal severe inflammation or active damage to the blood vessel walls right inside your brain. If you're finding this helpful, please like and share this video. Now it's time to ask a really vital question. Is normal cholesterol enough? A lot of people walk out of their doctor's office with normal lab numbers and think they are basically immune to a stroke. But as we're about to see, this is a very dangerous and potentially fatal misconception. Which brings us to Section 5, the hidden risk factors. We're going to shift focus to the systemic breakdown of blood vessels, proving that your risk goes way beyond just a cholesterol number. This right here is where the real mechanics of a stroke begin. Your blood vessels have this smooth, non-stick inner lining. When it's healthy, nothing sticks. But hidden factors totally destroy this. First, high blood sugar. When you have insulin resistance, the sugar stays in your blood while the cells lining your vessels literally starve. This damages that smooth surface, making the vessel walls sticky and prime for plaque to just latch on. Second, smoking. Every cigarette introduces toxins that cause massive inflammation, stripping away that non-stick lining while simultaneously making your blood thick and extremely prone to clotting. Third, blood pressure. Chronic high blood pressure physically batters and weakens your vessel walls over time. But surprisingly, sudden drops in blood pressure, like when you naturally slip into deep sleep, can cause blood flow to completely stall out in arteries that are already narrowed. This is exactly why some folks tragically wake up having suffered a stroke in their sleep. Now, age is obviously a factor. While the risk of a stroke certainly spikes after age 50, you might be shocked to learn that about 10 to 15% of strokes actually hit people under the age of 45. In younger folks, this is often due to hidden autoimmune conditions, undiagnosed vascular issues, or unchecked lifestyle factors that are silently damaging those blood vessels over time. Stroke is not just a disease of old age, guys. So the crucial point is, well, let's get into Section 6, time equals brain. We're bringing everything together here. There is a powerful, life-saving medical mantra, time equals brain. Every single minute that passes without blood flow to your brain literally kills millions of irreplaceable brain cells. Even if you experience one of the temporary warnings we've discussed today, like that black curtain over your eye, a sudden stumble, or a brief loss of words, and it completely goes away, you must seek immediate emergency care. Do not wait to see if it comes back. Your body is giving you one final chance to prevent a catastrophe. Will you be listening when it sounds the alarm? Subscribe to @Dr. Health Explained and turn on notifications for more science-backed health content.